Hi, my name is Dr. Dwayne Johnson. This week we're stepping into neurodevelopmental disorders. And at first glance, this topic can seem very straightforward. You learn the definitions, review the diagnostic criteria, and move on. But here is where it often breaks down in the real counseling settings. What looks clear in a textbook becomes much more complex when you're sitting across from a child, an adolescent, or their family trying to make sense of their lived experience. Let me give you a practical example. In a school or clinical setting, you may work with a student who has been identified with a neurodevelopmental disorder. On paper, the diagnosis is established, but in practice, the challenge is not just understanding the condition, it is navigating how the student experiences their world, how their family understands that diagnosis, and how culture shapes that interpretation. Some families may view this diagnosis through a medical lens, while others may see it as a behavior issue, a developmental delay, or even something that carries stigma. With that being stated, as the student transitions into adolescence, new layers emerge: identity, peer relationships, independence, and emotional regulation all become more complex. A common mistake is focusing only on the diagnosis itself, rather than understanding how neurological development, environment, and culture all interacting in real time. This matters because if we approach neurodevelopmental disabilities too narrowly, we risk missing the full picture. When this is handled incorrectly, it can lead to miscommunication with the families, ineffective interventions, and frustration for the individual. On the other hand, when you take a broader, more informed approach that considers history, neuroscience, and cultural contents, you are better equipped to support meaningful growth. You move from simply identifying a condition to actually helping individuals navigate their development in a way that is supportive and empowering. As you go through this week, I want you to pay attention to how these different pieces connect. Think about how history, culture, and neuroscience shape not just the diagnosis, but the person's experience, and begin to consider how you would respond in your future role as counselors when those perspectives do not always align. Thank you for listening or watching. Have a great day.